Hello and welcome to USBC's webinar series, Unpacking Commercial Milk Formula Marketing. Today's session, Commercial Milk Formula Marketing Organizing for Impact, is the third session in this series. Over to Amelia Pismythe-Seeger, US Breastfeeding Committee's Deputy Director and today's moderator.
Hello, good morning, everyone. I'm Amelia Pismythe-Seeger. I'm very pleased to be bringing you into the third of this webinar series that we've been engaged in across this summer, really marking out a shared learning journey together related to the International Code of Marketing for Breast Milk Substitutes and how the United States is situated and how different communities are impacted. So next slide, please. So we want to talk a little bit about how did we get here? So we really believe that if we want to create large-scale change, we need to begin with having a shared understanding about a topic. So we started several years ago with surveying our member organizations. And that 2019 survey really demonstrated that we had a fractured understanding of the code. And so here at this 40th anniversary, we began to plan a webinar series to support our learning journey. And member organizations have been expressing an interest in also actively engaging in this topic. So as we close out today's webinar, which also closes out this webinar series, we're going to talk about the next steps and how, as an organization, we would hold a collective conversation about what's possible for collective action. We began that process prior to launching the webinar series with what we call an incubation conversation. And that's the first step in our process of testing if we have the collective will and also the organizational capacity to be able to form an action-focused work group that we call a constellation. So that's the context that brings us in today. Next slide, please. All right, so as we said, three webinars in this arc. The first one was communities, contexts, and impacts. And we heard from international speakers on both addressing what the code isn't and is not, and then also some of the international efforts to be forwarding an understanding of how are breast milk substitute companies performing, what are their actions, and then related to that, what is it that as national and international communities we could be addressing. The second webinar looked at communities and emergencies. So in particular, what is the community impact and experience of the marketing practices in various communities, and in particular, what happens in an emergency when we know that disparities get heightened, those most impacted are even further impacted. And so understanding the role that breast milk substitutes plays in that greater context. And now we come to today's webinar. We're calling Organizing for Impact. We're very excited about our speaker panel, which we think is going to really help to elevate the conversation towards the now what do we collectively do. Next slide, please. All right, so for today's agenda, our panelists are Sally Mancini, Jennifer Pomeranz, and Marsha Walker. Then that will be followed by a facilitated question and answer session. And we have a few announcements for you, including that conversation about where we go from here. Next slide, please. All right, so let's really, kind of wind in here to the context for today's session. If we want to create real change, we need to understand the policy levers. So, we spent a lot of time at USBC really researching what are the headwaters of a particular policy or systems or environment that creates the context that then is impacting ultimately families and those who serve and support them. So we need to understand, how do these different institutions work and what are the possibilities for change? Who do you have to impact? What are the conversations? How does the thing even work? And part of what we also benefit from is understanding both past things that have been tried and some of the potential actions for advocates that we could be taking today. Next slide. All right, so here are our three panelists. I'm going to introduce them one at a time before their sessions. So next slide, and we'll bring ourselves into contact with Sally Mancini. She is the Director of Advocacy Resources at the Reynolds Center for Food Policy and Obesity, leading efforts to inform the public, community organizations, advocates, and policymakers about the center's research related to food marketing to children and its impact on health disparities. She also helps state and local advocates develop the resources necessary to support food policy improvements in all communities. She has more than 15 years of experience in nonprofit development and management, advocacy and government relations, and coalition building. Prior to joining the Reynolds Center, she coordinated advocacy and public policy campaigns for public health clients as a lobbyist with Judith Bly Government Relations. She's also a consultant specializing in project management and program evaluation for Middlesex Hospital and marketing and communications for the CT firm, Bureau Association, and City Seed. So we're very pleased to have Sally join us today, and I will turn it over to her. Thank you.
Thank you for having me. I'm going to share my screen now and pull up my slides. Oh, I need to have access to the screen sharing. There we go. Okay, can you see my slides?
Yes, we can.
Okay, wonderful. So thank you, Amelia, for that wonderful introduction. Again, my name is Sally Mancini, and I'm the Director of Advocacy Resources for the Reynolds Center for Food Policy and Obesity. And I'm going to be talking about infant formula and toddler milk marketing in the United States and Reynolds Center research. Now, I wanted to just start off by telling you a little bit about the Reynolds Center. Our mission is to promote solutions to childhood obesity, poor diet, and weight bias through research and policy. We pursue this mission by conducting research to inform advocacy and policy efforts, supporting evidence-based solutions through evaluations, and challenging the status quo. We also hold the food industry, media, government, and others accountable for their actions. And one of the ways that we do this is through our facts reports. In our facts reports, we're able to look at advertising spending by food and beverage companies, and we've looked at a number of categories of foods and beverages that are advertised to kids, including sugary drinks, fast food, cereal products, snacks. And in 2016, we released our baby and toddler food facts report. And that's what I'm going to be talking about today. So the purpose of Baby Food Facts was to document companies' baby and toddler food and drink marketing practices. We wanted to use the findings in this report to evaluate how companies' marketing of these products either reinforces or contradicts expert advice on optimal feeding practices to promote young children's long-term health. And we were able to document products and messages that may not communicate best practices to parents, including those that serve to discourage breastfeeding, promote toddler milks, and lead parents to infer that commercial infant formula may have benefits over breast milk. And we're doing this really in the context of underscoring the importance of optimal nutrition in early childhood. We know that birth to 2 is a very important time for establishing lifelong and healthy dietary preferences, supporting healthy growth, and preventing obesity and other diet-related diseases in children. And especially for parents of young children, it can be a particularly meaningful and often difficult time when parents are seeking information and advice on children's feeding practices and establishing habits. So what did we look at in baby food facts? We looked at the nutrition content of products, and we were able to score products using a nutrient profile index score, which is a measure of the overall nutrition composition of the food based on total calories and proportion of nutrients to encourage and limit. And it's a index that's used in the United Kingdom that identifies foods and beverages that can be advertised to children. We also looked at the marketing of these products. We looked at traditional media. We were able to calculate ad spending and TV advertising of baby and toddler foods and drinks. And we, on English and Spanish language TV. We did this by using licensed data from Nielsen from 2011 to 2015. And we included brands in our analysis that spent $100,000 or more in total advertising in 2015. We also were able to look at marketing in digital media, including food company websites, display ads on third-party websites, and social media. And we did this primarily using ComScore data. We did content analyses of TV and magazine ads, posts and mom blogs, and we also looked at product packages. And I'm not going to touch on the product package piece today because Jennifer Pomeranz will be covering that in her presentation. So what did we find? In 2015, we found that advertising spending for baby and toddler food, infant formula, toddler milk, and one nutritional supplement, Pediasure, totaled $77 million in all media. And but that was primarily in TV and magazines. And just 3 brands, Nestle, Abbott, and Mead Johnson Nutrition, or 3 companies and 8 brands were responsible for 99% of all advertising spending. And you'll see this pie chart shows the amount that was spent in different categories and shows the 8 brands that were responsible for 99% of the advertising. From here on out, I'm going to focus on our findings in infant formula and toddler milk. So I'd like to quickly go through the definitions that we used in our report for infant formula and toddler milk. We used, we used the definition for infant formula that from the Federal Food, Drug, and Cosmetic Act. It defines formula as a food which purports, food that purports to be or is represented for special dietary use solely as a food for infants by reason of its simulation of human milk or its suitability as a complete or partial substitute for human milk. And the definition we use for toddler milk is powdered milk drink supplemented with nutrients, and that the company indicates is specifically for a toddler older than 12 months and younger than 3 years. Outside the US, they are also known as growing up milks. Examples of these products are Enfagrow, Nido 1 Plus, Similac Go and Grow, and Gerber Good Start 3 Grow. So now I want to pause and ask you all a question. From 2011 to 2015, do you think that companies' marketing of infant formula increased, decreased, or stayed constant? Okay. So what we found was that ad spending for infant formula and toddler milk actually switched places in 2013. From 2011 to 2015, infant formula marketing in all media declined by 68%, where toddler milk marketing increased by 74%. Now this was pretty shocking to us. This wasn't a finding that we had expected going into putting together this report, and something that we definitely wanted to look at more. So I included this slide in my presentation to show you that in 2011 and 2012, there was actually women had no TV advertising exposure to toddler milks, and which is pretty surprising. But then in 2013, you'll see that their advertising exposure to infant formula and toddler milks was about the same. And then in 2014 and 2015, their advertising exposure to toddler milks was higher than infant formula. So there was a big switch happened between 2011 and 2015 in the way that formula companies were advertising their products and increasingly advertising toddler milks. So now I have another question for you. In TV advertising messages for toddler milks, what do you think was the most common product feature mentioned in toddler milk ads? Give you a second to think about that. So we found that toddler milk TV ads most often promoted nutrition. And just 3 infant formula or toddler milk brands actually advertised on TV in 2015: Enfagrow, Gerber Good Start, and Nido. And Nido was advertised in Spanish language TV only. In this example of Enfagrow Toddler Next Step, I wanted to share a TV ad that we found that said 85% of brain growth happens in the first 3 years, which is why it's important that children get DHA. Enfagrow Toddler has DHA, which toddlers may not be getting in their diets. We also found that brands advertised their benefits for children's mental performance and played into parents' fears that their children weren't getting the right nutrients from other sources. So in this ad, we find a child that's trying to put together a puzzle, and the voiceover says, "Is something missing from your toddler's nutrition? Maybe it's DHA, an important nutrient that can nourish the brain. Enfagrow can help set the stage now for amazing moments to come." By the end of the ad, this toddler is easily able to identify the correct puzzle pieces, and the mom and child bond by building a large tower together. So now I'm going to talk a little bit about our findings in digital media. Just 3 websites offered by companies in our analysis had enough internet visitors in 2015 to measure using ComScore data: Enfamil.com, which advertised infant formula and toddler milk; Similac.com, which advertised infant formula and toddler milk as well; and then Gerber.com, which only advertised infant formula on their website. So in addition to detailed information about product nutrition and the appropriate developmental stage for each product offered, these sites included extensive information about feeding young children, other types of parenting advice, money-saving offers, loyalty programs, and customer helplines, including breastfeeding tips and guidelines. Enfamil.com emphasized supplementing breast milk with infant formula, and Gerber.com offered consultations with a lactation consultant and registered dietitian. And in 2015, these were the same brands that were featured on banner ads on third-party websites. I'm sorry about that. So just as I was saying, these same companies had display advertising on their websites, and the types of things that they were advertising were very similar. Their loyalty programs and their coupons, and we found that Similac and Gerber averaged 16.9 million and 15.7 million ads viewed monthly by parents and caregivers. And Enfagrow Toddler Milk and their infant formula averaged collectively 16.6 million monthly ads, and 60% of these ads were promoting Enfagrow. Okay, so let's move on to social media. So all brands in our analysis also utilized social media marketing in 2015, including company-sponsored accounts on various social media platforms, including Facebook, Twitter, Instagram, Pinterest, YouTube, and posts on mom blogs. In social media, brands frequently featured experts offering advice for parents on healthy eating, sleeping, and breastfeeding. And other common messages included the coupons and invitations to join these loyalty programs to reduce the cost of infant formula. Companies also commonly provided incentives to mom bloggers to post about their brands and invited posts from regular moms to submit pictures or share their stories on other social media platforms, spreading their messages virally. We found one extensive campaign sponsored by Similac, the hashtag End Mommy Wars campaign that featured entertaining but controversial videos that garnered more than 20 million views on Facebook and YouTube, and were supported by mom blogs and Facebook posts inviting mothers to join the sisterhood of motherhood. Notably, marketing for infant formula on the internet and social media did not include disclaimers that appeared on TV and in magazine advertisements and product packages, including that breastfeeding is best for baby and that parents should consult a pediatrician before use. So as far as Spanish language advertising on Spanish language TV, we found just 3 brands that invested in Spanish language TV advertising in 2015. But they did allocate a substantial proportion of their advertising budgets to this medium. So Enfagrow, Pediasure, and Nido spent approximately 16 million on Spanish language TV ads. We found that this advertising for Pediasure was 25% of their advertising spending, 54% for Enfagrow, and 100% of Nido's advertising. The messages on Spanish language TV were very similar to English TV, emphasizing that these products helped fill gaps in young children's nutrition and promoting children's growth and brain development. And we found very little evidence of marketing targeted to Black parents in 2015. Now, I just want to touch on toddler milk nutrition. We did look at the nutrition of these products, and we found added sugars in all of the products in our analysis. These products included Enfagrow, Gerber Good Start, Grow, Nido 1 Plus, Similac Go and Grow, and Happy Tot Grow and Shine. They contained added sweeteners including sugar, glucose, syrup solids, honey, and corn syrup solids. Just as information on the nutritional comparison of these products, if we did give MPI scores to all of the toddler milks, and we have here chocolate milk in the list, and some of the toddler milks had lower MPI scores than even chocolate milk, which is very definitely very concerning. So let's go back to our initial question in baby food facts. Does the marketing contradict expert advice on optimal feeding practices to promote young children's long-term health? And the answer is yes. We know for toddler milks that they are not recommended by experts. In 2019, 4 organizations represented by the Academy of Nutrition and Dietetics, the American Academy of Pediatric Dentistry, the American Academy of Pediatrics, and the American Heart Association released recommendations on beverages to encourage and discourage for children up to age 5, and toddler milks were not recommended. They can add extra sugars to kids' diets. They don't offer any nutritional benefit over a healthy, balanced diet. They are typically more expensive than cow's milk, and their advertised benefits are not supported by scientific evidence. So when we saw the advertising spending on toddler drinks, as I said before, we were really surprised, and we wanted to look into this more. How were parents interpreting these marketing messages? And did agreement with the marketing messages increase provision of these products? And so we conducted an online survey in April to June of 2017, where we surveyed over 1,600 US caregivers of infants and 6 to 11 months and toddlers 12 to 36 months. And we found that over 1/2 of caregivers of infants, or 52%, agreed that infant formula can be better for baby's digestion and brain development than breast milk. And 62% agreed that it can provide nutrition not present in breast milk. We also found that most caregivers of toddlers agreed that toddler milks provide nutrition toddlers cannot get from foods. And agreement with the marketing claims increased the odds of serving infant formula and or toddler milks. So we also conducted focus groups, primarily on toddler milks back in 2019. And I wanted to share some quotes from these focus groups that I think really illuminate how the marketing is impacting parents. So in this quote, a parent shared with us, because I got a little pamphlet of the Enfagrow, and then it listed like the milk, then it listed the Enfagrow, and then it showed what the milk had and what the Enfagrow had. So that kind of made me want to try it. And then it feels, as a mom, there's a lot of judgments, or there's a lot of things that you feel like you're doing wrong. And so these marketing, whether it's necessary or not, it definitely plays into that fear. And then finally, I feel like the marketing does a really good job of playing to mothers' fears, because who wants to feel like I didn't give my child the thing to support their immune system, or they're not going to have brain or eye development if I don't give it to them. So the main takeaways from our research so far is that from 2011 to 2015, formula companies increased their ad spending on toddler milks, while at the same time they decreased ad spending on infant formula. The marketing messages promoting infant formula and toddler milks may mislead caregivers about the benefits of serving them to young children, and our research supports public health campaigns to counter marketing and increase regulation of infant formula and toddler milk. So, so some of the policy recommendations that we included in our baby fat facts report and in more recent publications are geared towards different stakeholders. We call on industry to comply with the World Health Organization code and cease this aggressive marketing of breast milk substitutes. We also call on the U.S. Food and Drug Administration to establish a statement identity and labeling requirements for toddler milks, and consider regulating these products on par with infant formula. We also asked the U.S. Federal Trade Commission to consider enforcement actions against unfair and deceptive marketing practices. And for healthcare nutrition related professionals, they can issue clear statements that toddler milks are unnecessary, and educate parents and caregivers about the marketing and that these products are unnecessary. I wanted to finish my presentation by just sharing a few recent developments and actions that we've worked on in collaboration with a few other groups. So we worked very closely with Jennifer Pomeranz, 1000 Days, and Helen Keller International to talk about how, what action can be taken in the U.S. to decrease the marketing of these products. And in July of 2020, we submitted a citizen petition to the Food and Drug Administration that had 30 signatories and called on the FDA to take enforcement actions against misbranded transition formulas. These are products represented or purported to be for children 9 to more than 12 months of age, but are misbranded as infant formulas for those under, or for those 12 months of age and under. We also asked the FDA to expressly prohibit the use of the term infant formula or formula on any drink products represented or purported to be for use by children more than 12 months old, and to establish a common or usual name for toddler milks for use by children 12 to 36 months old, and require disclaimers to clarify age of use and proper nutrition for young children. I know Jennifer will probably get into this more in her presentation, but there isn't one universal agreed upon name for toddler milks as of now in the US. So that's something that we're asking the FDA to do. And then we also submitted a separate enforcement letter to the FDA on transition formulas as a follow-up to the petition. And we put together a model comment for others to submit in support of this citizen petition. And the petition is still available online, and folks can submit comments in support of this action by FDA. Finally, we've worked on counter marketing efforts to expose formula company marketing practices. We've created short videos for sharing on social media for use by healthcare professionals in dispelling the myths, the marketing myths around these products. And I think that's it for me. So thank you to all of you, and a huge thank you to Rudd's food marketing researchers, Fran Fleming-Malici, our Director of Marketing Initiatives, Jennifer Harris, our Senior Research Advisor who has led the research on this topic, and also Maria Romo-Palafox, a former Reynolds Center postdoc, and many others on the food marketing team. The research was supported by a grant by the Robert Wood Johnson Foundation. And I will now stop sharing.
Thank you so much, Sally. And before I introduce our next speaker, I wanted to also clarify that all images and brands that are shown in the course of this webinar are for the purposes of education and discussing research that's been done, and in no way construes promotion. The speakers that are here are supportive of and promoting an understanding of the code and working towards code compliance and other kinds of levers that are going to help to support optimal infant nutrition. We anticipate that this is obvious, but also wanted to make that explicit in the course of sharing this presentation with you all. So I'm very pleased to introduce the next speaker, Jennifer Pomeranz. Jennifer is assistant professor in the School of Global Public Health at New York University. Her research focuses on public health law and policy. She is especially interested in policy and legal options to address products that cause harm, the food environment, and social injustices that lead to health disparities. Ms. Pomeranz is author of the book Food Law for Public Health, published by Oxford University Press in 2016, and dozens of articles on the legal opportunities and barriers to enacting public health policies at the federal, state, and local levels. Ms. Pomeranz earned her Juris Doctorate from Cornell Law School and her Master of Public Health from the Harvard T.H. Chan School of Public Health. With that, I'm very pleased to turn it over to Jennifer. Thank you.
Thank you so much for your introduction, and thank you to everyone for attending. I will share my screen and get started. So I will be discussing the labels, excuse me, I'm just gonna, the labeling issues for breast milk substitutes. I just wanna make sure you can hear me. I'm seeing a chat. Can somebody just tell me if you can hear and see me?
I can hear and see your slides.
Great, thanks. I just saw a chat pop up. Okay, so today my learning objectives, I'm a professor, so I'm making it formal, that we will be able to differentiate among breast milk substitutes available for sale in the US and their labeling concerns, identify the labeling issues that violate the code, the International Code of Marketing of Breast Milk Substitutes, and or may cause consumer confusion, and then explain what the government can and cannot do to address labeling issues in the US. And I'll also mention marketing issues in response to a question during Sally's presentation. So globally, the issues are, the labeling issues are similar, but the laws are very different. And so this leads to very different outcomes in the US than most other countries. So the code was adopted in 1981. The US was the only country to not ratify the code at that time. It anticipates that countries will adopt laws to implement the code recommendations, and the US has not adopted any specific laws to implement the code. We do have a couple laws that overlap, but it was not for the purposes of adopting the code into law. The code also anticipates that manufacturers and distributors will adhere to the code regardless of regulations at the country level. And originally the code applied to infant formula, but in 2016, the World Health Assembly adopted Resolution 69.6, which expanded the definition of breast milk substitutes to include all the products that Sally described up to age 3. So in terms of labeling requirements, recommendations is really the correct word. The code suggests that labels should not discourage breastfeeding. There should not be images or texts that idealize infant formula. The label should clearly state that breastfeeding is superior and to be only used, that infant formula and breast milk substitute should only be used with the advice of a healthcare provider, and then instructions and warnings about proper preparation. So this is the original code sections. So I'm going to show also Sally discussed infant formula versus toddler milk, and there's a third category, and I'm going to bring this up in the context of labeling. So in the US, we have infant formula only. In other countries, there's also follow-on or follow-up formula that is from 6 to 12 months. We don't have that in the US because of the definition of infant and infant formula. So all infant formula is less than 12 months. What we call toddler milks and internationally are called growing up milks, or the 12 to 36 month products that Sally discussed at length. And then we also have this nebulous in-between group of products called that we are calling transition formulas. These are on the labels are indicated for either 9 to 18 months or 9 to 24 months. So you can see they straddle the two types of products. So then what type of labeling do we have for the various products at issue? So for infant formula, there's a specific labeling requirements and also ingredient requirements for infant formula in the US. But for toddler milks, there's absolutely nothing that's specific to toddler milks. So they must abide by standard food regulations. And I'm going to get into this in more detail in a minute. And then transition formulas, it's unclear. And so this was why we had in our petition, we asked, as Sally mentioned, we work closely together. So basically everything we have done, we do a lot together. So the petition that the Red Center spearheaded, we worked on together. And part of it was to ask the FDA to please, take some kind of enforcement action over these transition formulas. And I'll explain more about that in a minute, but it's unclear which labeling requirements they're supposed to be abiding by. So the FDA has these specific regulations for infant formula. It does define infant as less than 12, and infant formula is basically a replacement of breast milk solely for infants. The labels have specific nutrition requirements and specific requirements for nutrient content claims that are specific to the ingredients for infant formula. One example is, no sugar added is an okay claim, but there's an approved list of things for infant formula. The labels cannot be false or misleading. There must be directions and warnings about proper use and preparation. And then also a statement such as use as directed by a physician. So these are the infant formula labeling requirements. However, what we're seeing are a lot of additions to what you would hope for infant formula. We see a bunch of structure, these are called structure function claims, so these immune health statements, brain and eye development. We see a lot of neurological development type of claims. And then also these very, concerning claims about inspired by breast milk, our closest formula to breast milk. So these claims are not being regulated at the moment. What happened was the FDA in 2016 put out a draft guidance on structure function claims for infant formula. And they said they recommend that infant formula manufacturers have competent and reliable evidence to support these claims. This is consistent with how we regulate dietary supplements in the US, which are pretty loosely regulated. But at least there's some type of idea that there's going to be evidence to support the claim for these structure function claims. But remember, this was a draft and this was also only guidance. So this is not a regulation, it's not binding, and it was never finalized. In the US, we had a change of administration after 2016. It's not surprising that nothing has happened since then, but we do hope that the FDA will reconsider taking this issue up. The other thing that's really a shame is that the guidance did not apply to labeling claims that had these breast milk comparisons. So all of these claims are just completely unregulated, not even covered by the draft guidance that reflects the FDA's thinking on this. It's, again, a guidance is not a regulation, but it reflects the FDA's thinking. So even when we're reflecting FDA's thinking, there's no thinking on these breast milk comparison claims. So that's, again, concerning. So the toddler milks, they must abide by all FDA labeling regulations. Again, labels cannot be false or misleading. There's a broader allowance for nutrient content claims, the same ones you see on all packaged foods, like Pop-Tarts has a lot of nutrient content claims, so it's the same idea. There's no regulation of structure function claims for any foods in the US. Again, that's a problem. Now, interestingly, it cannot be offered for sale under the name of another food. And what that means is you can't say, you can't sell imitation crab, but call it crab. You have to say it's imitation crab, right? So we're going to see how that's relevant in a second. And also every product in the US food stores, they have a common or usual name. So the idea, crackers is a common or usual name. Cookies is a common and usual name. So you know what you're getting. So what we have is problems for these transition formulas and toddler milks. So as you can see, that the transition formulas, their statements of identity are not. They are not infant formula. They are not infant formula with iron. So this is basically violating the rule I just told you about using a different product's name. So this is why we would like the FDA to take some type of action, because the transition formula statements of identity are just not in accordance with FDA regulations. And then for toddler milks, we saw a wide array, and there are more than this, of statements of identity for what toddler milks were, meaning that there's no clear definition because there's no regulations on them. So it's unclear what consumers even think these are, except a lot of them, except for the Nido, had the word toddler on them somewhere. Nido did not, because there's no, we believe it's because there's no equivalent term in Spanish, but for the most part, most of them had the word toddler somewhere on their packaging. But even with what I just said, there are still other outstanding issues that I find that you would really need to read these labels, which is something I spend hours doing in supermarkets and pharmacies. But like, here's an example. This is a toddler formula, but the company's name is Babies Only. So, if you're saying that this is up to 3 years old, but you're calling it Babies Only, that's already confusing. And if you look at the back of the package, it says Babies Only is intended for a toddler 1 year of age and older, or when directed by a healthcare professional. Now that's a different statement than the statement that FDA had suggested for infant formula, right? The word "or" there gives you the impression that maybe a healthcare professional would say this is adequate nutrition for an infant, and it's called Babies Only. So I find these are the types of things that are confusing, but really not addressed by any type of regulation. The resolution 69.9 that I mentioned, the World Health Assembly recognized that a lot of misleading claims, they were pretty much referring to the structure function claims that I showed you on infant formula, but there's many more on also toddler milks, which I'll also show you, that there's a lot of misleading claims being made. And then the second thing the resolution addressed was expanding the definition of breast milk substitutes to include up to 3 years old, the products for up to 3 years old. And one of the main goals here was to say that there should be no cross promotion of products. And cross promotion is a form of marketing where the customers of one product are targeted with the promotion of a related product. And so what are we talking about here? Internationally, this has been shown time and time again. Here's a great example. I want to thank Helen Keller International for their amazing work on this. They have had many, they have found many examples of this, and this is just one. But this is what the World Health Assembly was talking about when it said cross promotion. So these are the 3 different stages in 0 to 6 months, 6 to 12 months, and 1 to 3 years. They look identical. They have the same bear. They just have like slightly different colors. And then of course the 1, 2, 3. So it's a step progression of products, but this is cross promotion. Now, why internationally, why would countries do this? What would be their reason? You could feel free to put it in the chat, but so internationally, why would companies do this? Why are they cross promoting? So internationally, the answer is going to be is slightly different than the US. So many countries outside of the US did adopt regulations against the marketing of infant formula, according to the code, but they have not done that for growing up milks, which we're calling toddler milks, right? So the reason the companies are then promoting these step formulas is that they can abide by the law, but they won't abide by the code. So now they can market infant formula on the sly by marketing the growing up milks along the same pattern of the step formula. So this is basically a way to get around the country's law saying that you can't market infant formula. Okay, so in the US, we found the same thing. So this is just one example from one of our papers I worked on with the Reynolds Center. And so we found the similar cross promotion here of the different transition and toddler milks. And then you can also see this with infant formula and toddler milks. So now in the US, if there's no marketing restrictions in the US, why are companies doing this? What would be their reason to do this in the US? Well, they still think cross promotion works, and it does. So that's one. But the second is this is a relatively new product category in the US. So bringing parents along the step of feeding makes it become a natural path to feed an infant. So if you're not breastfeeding, especially, and you start off in the infant formula, you go through the step process and you end up feeding your kid sugary beverages called toddler milks until they're age 3 years old. And I urge us all to think about this in a broader marketing context of the US marketing. So Taco Bell had the brilliant idea to create a 4th meal. This is the meal at midnight that you would want to have Taco Bell. So they created a 4th meal. And I really think toddler milks are being promoted in the US in a similar manner. This is a new meal that's unnecessary, not recommended by anybody, but that the companies have decided to introduce into the toddler feeding pattern. And so here we have a meal introduced into the college students' age feeding, and then we have the toddler milks that have been introduced into toddler feeding as a new meal period. And then lastly, on this part of my talk, the Reynolds Center and I also did a survey of over 1,600 caregivers of infants and toddlers, and we did find consumer confusion. So 11% of the infant caregivers reported serving toddler milk to their infants, and more than half of them actually believed they were serving infant formula. So they were confused by the labels for these products. And then we have the claims on toddler drinks, and these are the same types of structure function claims I showed earlier. But even worse than for infant formula, we have no FDA regulation. So you can see these are the same types of things we're seeing on foods across the supermarket. So there's no regulation for structure function claims, including on toddler milks. So because I'm a lawyer, I have to ask us what government action can happen in the US. The US has decided not to act on these products to the extent warranted. So what can the government do? So far we've had some non-binding action. The Surgeon General put a call to action to support breastfeeding and encourage code compliance, encourage claims that are not truthful or misleading, and then also encourage the public health community to conduct research on consumer perceptions. And then the FDA issued that draft guidance that I mentioned already on structure function claims for infant formula. What can government do further? So Congress can and should be giving the FDA explicit authority to regulate toddler drink labels, including their statement of identities. This was something we requested in the petition. Congress can and should give the FDA explicit authority to regulate structure function claims for I believe for all food, but especially for infant formula and toddler milks, because these are, during the developmental stage, it should be people and caregivers and parents should not be tricked into purchasing these products thinking that they're better than breast milk, which was actually another finding of our survey, that there was a substantial amount of caregivers that actually believed these products were better than breast milk for development. And that's hugely problematic. And that's all based on these claims and the marketing that we're seeing. So the government can ensure that evidence-based, all claims are evidence-based and not false and misleading. The FDA should take enforcement action against those transition formulas since they don't abide by the regulations. The other thing is in terms of marketing. So the Federal Trade Commission is in charge of marketing, while the FDA is in charge of just labels. For food, the FTC and state attorneys general, these are the lawyers that represent each state. So every state and territory has an attorney general that represents the state's interests. They both have very similar consumer protection authority, and they can bring actions against false, deceptive, and unfair statements and claims. So this is one example where the FTC brought an action against Kellogg's and said, you do not have science to verify that Cocoa Krispies can help support your child's immunity system. So this is the type of thing that the FTC and state attorney generals should bring an action against. Again, it's unclear why they have yet to do it. The Reynolds Center and I have been calling on this, and CSPI have been calling for this for quite some time, but we have had a different administration, and hopefully the new administration takes this up. There have been, to my knowledge, only maybe one plaintiff's lawsuit in response to the question in the chat. These tend to get dismissed in the beginning, and then maybe we'll see an uptick of those types of lawsuits in the future. What can government not do? So this is where the US is different from other countries. The government cannot ban images or claims that are not false or deceptive. So the code actually asks that marketing does not include pictures of bottles, and they call it teats, we call it nipples. The US cannot ban something like that. That is not a false or deceptive image. The US government can also not require onerous, non-factual disclosures or warnings. So I'm going to talk about disclosures and warnings in a second, but here's an example of an onerous one. So if this was the formula and the disclosure was this, and you had to put that on your product, that would be a problem. So the government could not do something like that. So why is the US different? We have a First Amendment to our Constitution, which protects the freedom of speech. And basically it's saying that the government cannot abridge the freedom of speech. And this has been interpreted to protect commercial speech, which is advertising and advertising on labels. It's very difficult to restrict, except if it's false or deceptive. And so here, the example in the top right corner was, and the FTC brought an action against Gerber for these claims that their product basically solved all of these children's allergies when there was only science to support that it addressed one allergy specifically. And then commercial disclosure requirements are also allowed, but there's a list of what we can do. Now, what are commercial disclosure requirements? They're disclosures and warnings that you see every single day in the US on so many products. So everything you see here is the warnings, the supplement facts, nutrition facts, the Surgeon General's warning. The one in the middle is a state requirement for honey, because honey under age 1 can cause botulism. So the top left are clothes have to have fiber and country of origin. So we have disclosures and warnings on tons of products and in the US. This is from the original 1990 passage of the Nutrition Labeling and Education Act. So I'm sure you know that the Nutrition Facts Panel has since been updated, but it still shows that we require the disclosure of factual, non-controversial information on food products already. The statement of identity on the bottom right, that's tomato soup, ingredients, allergens, and then the nutrition facts. So here's the question. What disclosures or warnings are constitutional? Unfortunately, the Supreme Court has been tinkering with common interpretation of when they're constitutional. So for decades, the courts have found that most disclosures and warnings, if they're factual, they're constitutional, if they're about the product. But recently, the Supreme Court put some of this into question. What we know is that a disclosure or warning must be about the product itself. What that means is the government couldn't say, all you candy bar manufacturers, you must have a disclosure that says eat fruits and vegetables, because that's not about the product itself. Now, here's where it gets a little tricky. It must be reasonably related to the government's interest in preventing deception of consumers. It didn't used to be thought that they only had to be related to preventing deception of consumers, but a recent decision has called that into question. But regardless, that works great for us for the toddler milk, transition formula, and infant formula arena. So that's not a concern. All of the disclosures or warnings we'd be talking about here are preventing deception of consumers. So that's great. It must be purely factual and uncontroversial. And it cannot be unjustified or unduly burdensome. What that means is it has to have some type of evidence base, and it can't be so big as to overwhelm the product, like in the example I showed you. So these were found to be unconstitutional. These were for tobacco. The FDA had proposed these. They were struck down. The examples given in the court's opinion were the woman crying is not factual or uncontroversial. The guy's t-shirt saying I quit is not factual and uncontroversial. Even the the person who died, not everyone dies from smoking, etc. So these were found to be not factual and uncontroversial. But what has been upheld are the textual warnings that we see on cigarettes and smokeless tobacco. The top one is from cigarettes. The bottom three are from smokeless tobacco. This product can cause mouth cancer. Warning actually is an important to keep in it. Warning, smokeless tobacco is addictive, and warning, this product is not a safe alternative to cigarettes. So what about thinking through some potential warnings for toddler drinks? You could put it in the chat, some ideas you might have, and then I'll show you some ideas I have. These, of course, have never been tried, but it would be great if we, in the public health community and researchers, we could try researching some type of warnings for toddler drinks, given that they're not recommended. They're basically sugary beverages masquerading as nutritional necessity. So one thing I came up with was to kind of take off of that smokeless tobacco ad, warning, this product is not a safe alternative to infant formula. A takeoff of the honey warning, do not feed to infants under 1 year old. And then just one I made up, warning, not intended for infants. So these maybe would pass constitutional scrutiny. Again, they've not been tested in court. These are just my ideas. And then the last thing I want to mention is that the government is not restricted by the First Amendment. So government speech is a different variety of speech. The government is allowed to say whatever it wants. That's why, you hear the government telling us to wear masks and get vaccinated, right? So that's government speech. They can take positions. Here are some examples, especially from New York City's Department of Health. The two on the left, these are public health, PSAs, and then also just different types of government speech. So the government is not restrictive. So lastly, I am going to give a little multiple choice question, and just to kind of summarize the second part of what the government can do. So the First Amendment restricts government from A, speaking out on health issues on its own, B, prohibiting false or deceptive advertising or labeling, C, requiring the disclosure of factual, non-controversial information about a product for sale, and D, prohibiting truthful and non-deceptive advertising and labeling claims. So why don't you put your answers in the chat, see what you think. So either speaking out on health issues on its own, prohibiting false or deceptive advertising, requiring the disclosure of factual, non-controversial information about the product, or prohibiting truthful and non-deceptive advertising and labeling. So the answer is D. The government cannot prohibit truthful and non-deceptive advertising and labeling, but it can speak out on health issues on its own. It can prohibit false and deceptive advertising, and it can require the disclosure of factual, non-controversial information about a product for sale. So in summary, I want us to really kind of reframe our thinking about toddler drinks, the way we've been talking, the way the public health community also talks about other sugary drinks for policy action and research, and kind of try to pull it out of the infant formula realm and bring it here to the sugary beverage realm in our thinking. So thank you so much. I look forward to discussion and comments and questions later. Thank you.
Awesome. Thank you so much, Jennifer. Give us a lot to think about. Really appreciate it. So our third speaker today is Marsha Walker. She's the previous executive director of the former National Alliance for Breastfeeding Advocacy. She's a registered nurse and international board certified lactation consultant. She has been assisting breastfeeding families in hospital, clinic, and home settings since 1976. And as such, she advocates for breastfeeding at the state and federal levels. She has been in leadership positions at ILCA, USLCA, Breastfeeding USA, and her coalition in Massachusetts. And as a longtime leader of National Code Advocacy, Marsha is helping USBC to welcome a new and diverse generation of champions. So we're pleased to hear from Marsha today. So Marsha, Alyssa's going to share your slides, and you can unmute and share your video if you'd like.
Thank you. Can you hear me okay?
We can.
Good, thank you. We're going to talk a little bit now about some advocacy levers. And I'm going to go through a little bit of some of the type of marketing that's going on in the US and what is it that we can do about it. Now, am I able to advance my slides, or do you?
Alyssa will do that. So you can, yeah, you can ask to have the slides advanced just like I did.
Oh, good. Okay. Oh, how do I advance the slides? Oh, there they go. So the scope of the code talks about breast milk substitutes, which are infant formula, other milk products, and food and beverages. And obviously today we're talking about infant formula. And that's when it's marketed as a partial or total replacement of breast milk. And the code also includes feeding bottles and teats, artificial nipples, but we're talking about infant formula today. So formula marketing is nothing new, but it has gotten more sophisticated, technical, and effective. Prior to 1980, most formula marketing was done through physicians and hospitals. But in the late 1980s, Nestle entered the US infant formula market, and they began advertising their Carnation brand directly to consumers. And this caused a huge furor over this type of marketing when it was done directly to a consumer. And back in the day, infant formula advertising began in parenting magazines. It was on television. There were direct mailings, sampling. But now it's taken all of that to a higher level, and it is very sophisticated and highly technical. Oh, I can't. I'm having trouble finding how to advance the slides.
So Alyssa is displaying them for you, Marsha, and so you can.
Yeah, sorry, there's nothing here to do that. There we go.
There you go.
Now what we have is the digital expanse. digital advertising has just consumed the infant formula genre of how it's being marketed, because parents today live in the digital expanse. Consumer data is collected across all of your connected devices, including smartphones, tablets, personal computers, smart televisions, and even smartwatches and other wearables. In other words, when you click on, if you go to look for a pair of shoes, and you go to a particular website and you find some shoes and, oh, this is nice, you know, within seconds, an ad for those shoes or that company is going to show up on your Facebook feed, because everything is connected. So an inquiry online, or parents who announce their pregnancy announcements, these can trigger targeted advertising for baby products on all of the person's digital devices. Now, the infant formula manufacturers and retailers also collect consumer data, and they may purchase data from an ad targeting services or from data brokers. And what I've got on the right-hand part of the slide is the types of information that data brokers collect. So they can collect data from hospital baby photos. When parents have those baby photos taken and they fill out all of their personal information to get those photos, that information is typically used and or sold to data brokers, from whom other entities can purchase this information and target their ads. Parents fill out warranty cards for baby equipment, pregnancy or birth announcements online, anything bought at maternity stores, when purchasing baby items with a credit card, when they enter baby contests, or when they sign up for baby-related coupons, gifts, and baby registries. All of this data is collected. Plus, birth certificates are public records. So now you've got a vast amount of personal data collected that can be used by infant formula manufacturers and retailers to target ads to those people who are most likely to buy their product. Next slide. Now, given all of this, how can marketing be even more effective? Well, there are very sophisticated ways of mining data. One is called predictive analytics. And what this does, it is a computer-generated method of identifying consumers who are most likely to purchase infant formula, or any product for that matter. So there are algorithms to figure this out. There is artificial intelligence and machine learning, where the machines learn the buying habits and offer you targeted ads. There is what is called history sniffing. I don't make up these terms. These are legitimate terms. History sniffing, which captures all of your web browsing data. You go up there and browse through a bunch of different products or different websites. Somebody has captured that data. Advertising on third-party websites. The graphic on the right, that's Walmart. Okay, and here is an ad for the Strong Moms Rewards from Similac. You sign up for that and you get $300 or $400 worth of stuff from Similac, and this is up on Walmart's website. Similac, Gerber, which is Nestle, and Enfamil average about 16 to 17 million banner ad views per month on third-party websites. So those third-party websites are saturated with infant formula ads. Amazon.com, Facebook.com, and Walmart.com are the leading third-party websites that host ads for baby and toddler food and drink. And we've just talked about these toddler foods. And those are where you see the bulk of these types of ads. Facebook and Instagram feeds contain direct purchase links to easily buy formula, so that when these come up, if you're looking at a Facebook feed, there is always going to be a link that a consumer can click on to go directly to purchase the product. Now, it's interesting because Facebook and Google prohibit tobacco advertising, but they do not restrict infant formula advertising. Next slide. There are many ways that these products are marketed. Much of these are marketed through these helpful services, where you see promotion of different types of discharge programs, which include various ways that the names of mothers are turned over to the companies in exchange for free formula to either the hospital or directly to mothers or both. Okay. There are branded and non-branded virtual in-service training for hospital staff on a variety of topics, including breastfeeding. There are morale boosters for hospital staff. So marketing has directly invaded, which we know, hospitals, because that's where breastfeeding starts. So it pays to have the hospital staff on your side if you are marketing particular products. Now, infant formula companies are very quick to take advantage of just about anything they can, including emergencies. To them, the baby-friendly hospital initiative was an emergency and continues to be an emergency, because that's one of the best places they start. Well, the parents get this before they deliver, but it's a good place to start with promotion of infant formula. So offering cash-strapped baby-friendly hospitals cash, supplies, equipment, education, etc., in return for accepting free formula to help them save money due to the loss of the caused by the reduction in elective procedures and the cost of combating COVID-19. So what the companies did is they stepped in to, including baby-friendly hospitals, to offer them all types of incentives and just outright cash sometimes to market the products during the COVID epidemic, and that is still going on. Now, the companies also target vulnerable populations, including low-income families, with free samples and sales discounts linked to COVID-19. And this, to me, is particularly egregious. They will also market their products by zip code. In other words, they will look for particular zip codes of low-income populations and target those populations specifically with certain types of ads. They use, and we've talked about this already, previous speakers have, unfounded health claims regarding how infants will benefit from immune boosting ingredients in infant formula. Well, we're in the middle of a pandemic now, and who doesn't want to boost a baby's immunity? Well, here comes the infant formula company stating quite blatantly that their product is going to boost infant immunity, even though we know breast milk, human milk, is the best way to do that. Next slide, please. What is worrying me the most right now is the escalation of power by influencing policy. And this is what companies have been doing for years, but it's getting stronger and stronger. They have formed trade associations, which are actually lobbying groups. Lobbying shapes international standards, such as those from the Codex Alimentarius Commission and the World Health Assembly, and constrains implementation of the code at national levels. Now, Codex is a collection of internationally adopted food standards and has 189 countries, including the US. And what these lobbying groups do, what the companies do, is try and influence Codex and WHA into watering down or preventing the types of things that we have been talking about here in terms of protections for infants. The scope and the strength of the code is undermined by the actions designed to weaken the technical standards and norms for infant nutrition. So if they can do this at the international level, it means that they don't have to abide by certain types of marketing statements that they can make, or putting in certain types of ingredients or not putting in certain types of ingredients into foods marketed for infants. For example, in 1980, industry forced the adoption of the code as a recommendation, not as a stronger regulation, to appease the US government, which at that time financed 25% of WHO's budget. Okay, now what this means is the recommendation of the code is non-binding, and that's why we are in a lot of the problems we see today, because it's simply a recommendation and not binding on any country at all to implement any part of the code. Another example, in 2016, the formula manufacturers lobbying group lobbied US officials to oppose WHA 69.9, and previous speaker talked about that. And that was the resolution that contained technical guidance regarding products marketed as toddler or follow-on formulas. And it also had another provision, and that was a call to end all forms of inappropriate marketing. Well, you can imagine what this resolution did to formula companies. Okay. So in 2018, as another example, the Trump administration opposed WHA Resolution 69.9, which called for an end to all forms of inappropriate promotion. The US delegates during the WHA meeting worked to water down this wording and threatened to remove military support from Ecuador, who was the proponent of the resolution. They're the ones that proposed this resolution. And this is what I mean by corporate power now that is influencing policy at very high levels. Next slide, please. We know that companies spend millions on lobbying members of the US Senate, the US House of Representatives, the Food and Drug Administration, the State Department, and the US Department of Agriculture. And this makes it much less likely to pass any national legislation regarding the code. We would need to get a legislator to file a bill that would prohibit or restrict some of the marketing that's going on in the US, and that's very hard to do. They have also insinuated industry partnership into international initiatives to improve nutritional outcomes. There is going to be a food systems pre-summit and summit, and there is a committee on world food security. And the infant formula companies are front and center at these international initiatives to make sure that they do not have to weaken or change any type of marketing that they do for their products. Next slide, please. The next thing that the companies do is capture science, research, and knowledge. They have cornered the research on infant formula through corporate nutrition research divisions. This is where the bulk of research is done on infant formula. And what this does is it allows industry to shape infant nutrition and actually determine what babies are fed. Right now, the infant formula companies determine what babies are fed in terms of what's in infant formula. There are 29 ingredients that are required by the FDA to be put into infant formula that's marketed in the US. Only 9 of those ingredients have any type of mandated amounts that need to be in the formula. Everything after that can be added to infant formula without any type of FDA approval or FDA demands for research. All it has to do is pass what's called GRAS, generally recognized as safe. Okay? They interpret infant nutrition based on their formulations. And the additions of these designer ingredients drive sales by portraying their products as closest to breast milk. And you can see these on the ads on the right-hand side. They make claims about health and developmental benefits of their products. And what this does is it shapes public opinion as formula being safe, scientific, and it detracts from the health implications and hazards of its use. Now, if you look at the formula called Inspire, this is from Mead Johnson. And if you look at the front label, it says colostrum and breast milk in very bold print. Okay, now this might persuade parents. It might look to consumers like this particular formula actually has colostrum and or breast milk in it. And this is very scary. If you look at the Similac Pro Advance, it says our closest formula to breast milk. It has 2-FL-HMO, a unique prebiotic that helps support your baby's immune system. Well, if you look at the label on that Similac can, you see the little teardrop shaped graphic there, and it says HMO, human milk oligosaccharides. And in very, very teeny tiny print, it says not from human milk. Now, who's going to read that teeny tiny print? Those human milk oligosaccharides, these HMOs in formula, they are sourced from a non-pathogenic form of E. coli bacteria. That's where that comes from. Certainly not human milk. And look at the price between the two formulas. Adding particular ingredients to that Inspire infant formula allows them to charge $41.99 at my local grocery store for that product, compared to the $28.12 for the other product. Okay, these are both infant formulas. They both have the 29 mandated ingredients in them, but look at the price difference. Next slide, please. These three companies especially, and I picked them out because they have these nutrition research capabilities. Nestle Nutrition Institute, Abbott Nutrition Health Institute, and Mead Johnson Pediatric Nutrition Institute. Nestle has the largest one of these private nutrition research capabilities. They have 5,000 staff across 30 worldwide facilities that do nothing but research infant nutrition. They generate over 200 peer-reviewed research articles every year. Most of what you read in medical journals or peer-reviewed journals about infant formula has been written and researched and or funded by an infant formula company. Now, a lot of you are familiar with Abbott, who conducted the Ross Mothers surveys. Any of you who are my age are going to remember it. Many years they conducted this. And it was used by researchers and actually the government at that time to track breastfeeding and formula feeding statistics. This was used as a marketing tool to generate data on how better to market formula, even though the survey looked to be something legitimate. Okay, the survey, this particular survey was recently disguised as coming from the National Institute of Infant Nutrition, so that parents filling out the survey were duped into thinking they were providing a valuable service in terms of helping researchers better put better ingredients into infant formula. Now, Abbott, Mead Johnson, and Danone are members of the International Life Sciences Institute, the ILSI. That's an industry-funded lobbying group. This promotes industry positions for health policy issues in the US and internationally. So their reach is very, very insidious. Next slide, please. Industry employs world-leading advertising, branding, and public relation agencies. The picture you're looking at on the right is not the NASA control room for blasting off into outer space. That is actually what Nestle calls digital accelerators. And what they do at this center is they track online sentiment regarding Nestle products. And they will react and respond to any negative sentiment about its products that they see anywhere in the digital expanse. Any type of blogs, any type of disparaging remarks about their infant formula or any of their products for that matter are immediately picked up and responded to. Many of these companies pay influential bloggers to speak positively about their products, knowing that parents rely on peers for infant feeding information. So there has been a lot of insinuation of infant formula marketing into areas where parents don't even know they're being marketed to. Next slide, please. And our previous speaker mentioned the Sisterhood of Motherhood campaign by Abbott. And what they did is, as a way to help with their sagging sales, they deflected attention away from the problems with infant formula and their sagging sales and the negative image of the product and the company. And they put together a very creative solution that provided emotional support for mothers. The campaign knew that historically media was unreceptive and very negative about messages from Similac itself. And so what they did is they put together this video that was inclusive and non-judgmental, etc. The outcome was the Sisterhood of Motherhood campaign was the most successful campaign ever for Similac and the first equity-based campaign brand. What that did is it increased sales by 2.2%. That's a lot of money. And the Similac brand rose from 13% to 93% positive media coverage during that year. And they garnered 120,000 new Facebook friends. Very, very effective to sell that product. Next slide, please. Don't you wish you had the millions of dollars that went into that campaign to market human milk feeding? So the Access to Nutrition Initiative, I'm just putting this up here because it is a very recent look at the comparison between infant formula companies in terms of how they were adhering to the code. It's the index of compliance, and I've given you the website for that. It's very interesting reading. Now, what they found was there was inconsistent application of policies to all products, non-universal application of policies to all countries, and failure to support all tenets of the code, which everybody on this webcast knows. Okay? This ongoing non-compliance undermines their claims that they claim to support breastfeeding. So it's very clear in this report that there is no real true intent to support breastfeeding on the part of infant formula manufacturers, even though it may say on the label that breast milk is advised for your baby, but infant formula is a good alternative. Next slide, please. Okay. Here is what you can do next. This is your to-do list for the rest of this lecture. As we continue talking about what we can do to better implement and give voice to the code, jot down your ideas so we can brainstorm how to more effectively proceed. You can put this in the chat list, you can send it later, but this is what you're going to do from now on. Is how are we going to counter what we learned about today? Next slide, please. Well, let's talk about what we can do. Our previous speaker talked about the Federal Trade Commission. The FTC enforces the prohibition of unfair and deceptive trade practices. What we can do is we, as a group, can petition the Federal Trade Commission to take action against false and misleading formula advertising. We can ask for a civil investigative demand. We can demand that, that's our right. We can seek a permanent injunction to prevent marketing of infant formula products if the claims are false and misleading. And the picture on the right is just a petition to the Federal Trade Commission that I was involved with in 2008, along with the Cornucopia Institute, relative to the addition of DHA into infant formula. And I can certainly give you the link to the entire petition that we sent. So this is something that we can do. It's not that difficult to do, and it's something that is, I think, long needed. Next slide, please. What else can we do? We can ask the Network Advertising Initiative and the Digital Advertising Alliance to include pregnancy and breastfeeding to be covered in their marketing codes. Now, these two entities are self-regulatory bodies for how digital advertising industry collects and uses sensitive information. And so we can ask them to include pregnancy and breastfeeding in their marketing codes. Parents, users, can deselect interest categories like infant formula that have been assigned to them by Facebook. So we can help parents reduce the amount of marketing that they see in their own digital areas. Users can also indicate that they don't want advertisers to target them by using profile information about relationship status and job title. So they have the ability to go into their Facebook, whatever you call it, I forget what you call it. Their profiles, they can go in there and start deselecting certain things that they do not want to see appearing in their Facebook feeds. Next slide. Okay. We can ask Facebook and Google to address infant formula in their advertising policies. Both companies have the capability to restrict infant formula advertising on their platforms like they do for the tobacco advertising. Why can't we do the same? These advertising policies operate parallel to WHO's Framework Convention on Tobacco Control and its recommendations on the marketing of foods and non-alcoholic beverages to children. So like tobacco marketing and food marketing to children, infant formula marketing has been deemed harmful enough by WHO to warrant a moratorium on advertising to the general public. Therefore, these ads should be restricted on Instagram, Facebook, and Google. And the graphic on the left just shows you, this is from one of my Facebook feeds, what comes up here. So this is the type of thing we would like to eliminate from Facebook, so that each time somebody goes to a website that has anything to do with infant formula, it does not immediately show up on your Facebook feed. And if you look at the bottom of that ad where it says shop now, all you have to do is click on shop now. You are taken directly to be able to buy that particular formula. Next slide. Food and Drug Administration, and our previous speaker talked about this. They regulate infant formula ingredients, but only to a certain point. These structure function claims describe the role of a nutrient or dietary ingredient intended to affect the normal structure or function of the human body. For example, calcium builds strong bones. And I've taken this and the next one directly from the FDA website. These structure function claims characterize the means by which a nutrient or dietary ingredient acts to maintain such structure or function, for example, as fiber maintains bowel regularity or antioxidants maintain cell integrity. Those types of claims are permitted. Now, any of these types of structure function claims do not require prior authorization by the FDA, and they are not subject to a low level of evidence that does not need to be shared with the FDA or the public. So essentially, just about anything can be put on the labels of infant formula because these structure function claims don't require any type of evidence to support them. And if you look at Neural Pro over here, supports immune health with the 2-FL-HMO. That's a structure function claim. Brain building, expert recommended DHA, inspired by breast milk. And the little thing on the last thing on the right, that MFGM, that is a designer ingredient that is put into again into infant formula that is supposed to help with the immune system. Okay, so none of these claims here, none of these structure function claims have any real evidence behind them. Next slide, please. So the industry really doesn't have data to support these claims. And of course, the industry doesn't comply with recommendations or suggestions. Back in 2004, the Institute of Medicine published recommendations relative to assessing the safety of ingredients that were new to infant formula. And this was provoked by the addition of DHA into infant formula, which, by the way, has been shown to not result in what the claims say it's supposed to do. In 2016, our previous speaker mentioned this, the FDA issued the first draft guidance, which outlines the quality of evidence that manufacturers should have to substantiate the claims. But of course, nothing has happened with this. Most of these claims do not have any evidence available to the public that supports the claim. Now, when you look at what they publish in peer-reviewed journals, many of these randomized controlled trials that are made public are limited by small sample sizes, poor follow-up, and questionable results. You have to look very closely at the research article that is published to see the type of shoddy methodology that is often done in these research articles. How they get published, sometimes I have no clue, because when you look at even at the sample groups, they compare one formula sample to another, and they completely leave out a control group of breastfed infants. That's beside the point. Next slide. What else is going on? Okay, here is a structure function claim that I question very, very closely. This Enfamil NeuroPro Gentle Ease. Okay, the way it is marketed, it said it's designed to ease fussiness, gas, and crying in 24 hours while providing nutrition for healthy development. Now, here are parents that they're sleep deprived, they're exhausted, their baby has been crying for the last 5 days since they brought the baby home from the hospital. And here is a formula that says that crying is going to be stopped in 24 hours if you use this formula. That is pretty appealing to somebody who can't even see straight. And you look at the claims on the right-hand side of this slide. The only formula in the US with a blend of lactoferrin and MFGM, okay? Lactoferrin is associated with fewer digestive and respiratory issues. And here we go, the whole list of why this infant formula is wonderful. All of these claims, okay? How is a parent supposed to sort through all of this? And basically they can't. They are taking the word of the formula company that all of this stuff is going to make their baby healthier, because the milk fat globule membrane, the MFGM, in formula supports cognitive development similar to breast milk. This is very appealing to parents. Next slide, please. So what are the consequences of these claims? They're not supported. Well, they can confuse parents into thinking that formula is equivalent or superior to breastfeeding or breast milk. Parents may avoid or abandon breastfeeding when unsubstantiated claims supersede science. These designer ingredients that are being put into the formula substantially increase the cost of formula to parents and the government. The US government is the largest purchaser of infant formula in the US and the world. Okay? Now, both parents and the government are going to pay for designer ingredients that have little to no proven benefits to the infant. And the claims reduce the reach of federal nutrition programs because they're paying so much for this infant formula. Next slide, please. And our problem here is, as was mentioned already, the FDA lacks the authority to enforce any of these guidelines. Now, can we do something here? Can we work to change the law requiring pre-market approval by the FDA of any structure function claim? Could we have a law that says, okay, before you put a structure function claim on any infant formula product, you have to have some type of approval process by the FDA who actually looks at the data and looks at the science behind it. The FDA should require submission of substantiating data, which should be made available to the public. Now, what if we leverage, we're talking about levers here, what if we leverage the WIC program to only purchase infant formulas that were approved by the FDA as having high-level validation of any claims? This may be a lever that we could use to reduce these types of claims or eliminate them so that parents are not so vastly confused about these products. Next slide. How about moving this into states, state hospital regulations? The Department of Public Health in most states regulates hospital licensure. They're the ones that state what hospitals need to have in order to operate. Okay? Now, within these hospital regulations, there are perinatal regulations. The perinatal portion could be amended to prohibit distribution of commercial formula discharge bags and gifts, as we did here in Massachusetts, and many other states followed suit. We started the Ban the Bags campaign to get these formula company discharge bags out of the hospitals. None of our hospitals here in Massachusetts give out these bags. Now, that's not to say those bags aren't given out. They're just not given out in hospitals. This is lower hanging fruit, so to speak. So we could start doing that to make sure every state had hospitals who no longer gave out these products. That's a form of marketing in a very, very effective way too. Next slide. What we found here in Massachusetts, of course, is as we got rid of the formula discharge bags in the hospital, they simply moved them over to the physician offices. On the left-hand side, you see the display on the check-in counter in a pediatric office. When the parents take their children into this particular pediatric office and they go to check in, that's on the check-in counter where they can take a free sample. On the right-hand picture, this is an obstetric office, and the sign, the little sign above all of those those gift bags says, "Help yourself to formula samples as you walk out the door." Next slide. We can complain to the Better Business Bureau. We could file a complaint with the Better Business Bureau. Now, the Better Business Bureau has what's called the National Advertising Division, NAD, and that's the investigative arm charged with monitoring and evaluating truth and accuracy in national advertising directed towards consumers age 12 and over. However, we see that infant formula companies complain to the Better Business Bureau about each other. Next slide, please. This is an example. Nestle Nutrition challenged claims that appeared in online advertising for Nutramigen infant formula. And they challenged the claims that included Nutramigen is the only hyperallergenic formula with no sugar added. Okay? So they challenged these claims. And in response to Nestle's challenge, Mead Johnson discontinued those claims. Okay? Now, it turns out the National Advertising Division will also take challenges from organizations like us and from people like us. So one of the things I think we ought to try and do perhaps is challenge these claims through the National Advertising Division of the Better Business Bureau. Now, what this would do, I think, would help us tremendously in reducing some of the claims that we're seeing. Next slide, please. Our state attorneys general, okay, and this was mentioned. As an example, from March 2015 to April 2017, Abbott sent 200,000 marketing surveys to residents of New York under a bogus institute name, asking if infants had been breastfed, and if formula fed, they wanted the name of the formula that the parents had used. Now, the letter suggested that the institute conducted monthly surveys to understand infant nutrition. It went on to urge consumers to complete the survey to help with important research. This is the Ross Mother Survey, reinvented. Now, what the state attorney general did is investigated, and under the settlement, Abbott was required to accurately disclose the purpose for which the survey information was sought, and Abbott was prohibited from falsely representing that these surveys were being conducted for scientific study. They had to pay $50,000 in costs and disclose at the top of any survey either its name or the name of any third party conducting market research on its behalf. We could ask state attorneys general to investigate infant formula marketing in their state. And this might be something that could be done on a state by state level. Next slide. I think what we need to do, if we're really serious here, is let's consider creating a strategic plan to reduce infant formula marketing. How can this be done? Who else can we enlist to help with us? Our speakers from the Reynolds Center can help. The Center for Science and Public Interest could help. And I bet all of you could jot down in the chat box many more entities that you think could help us with this. What resources do we need? What pushback and challenges should we anticipate? Ooh, and there will be many. What about doing a SWOT analysis? Strengths, weaknesses, opportunities, threats, for us to consider in terms of countering formula marketing. How about creating a funded code monitoring entity? We could conduct a formal national code monitoring project just to get an idea of the extent of what's going on. We could even form a delegation to the World Health Assembly. We could contact our US delegation to WHO with our recommendations. Don't you love the ad on the right? That's infant, that was infant formula that was fed to infants many moons ago. And it consisted of maltodextrins and dextrins resulting from the enzyme action of barley malt on corn flour. Sounds very, very appealing. It even had sodium chloride. It had salt in it. That was good too, because if you look at the circle, it says number 1. Not much has changed. Next slide, please. These are just 2 code monitoring reports that were done in 2001 and 2007. These were formal reports. But I think it's time that we do another one, mainly because things have changed so much from then to now in terms of how the code is being danced around in the US and what is the extent really of what's going on. Next slide, please. And what I've given you are just some references that I used for this presentation and some things that might be of interest to you if you wanted to read on. Next slide, please. I just wanted to thank you all for the opportunity to speak today.
Oh my gosh, thank you so much, Marsha, for sharing your wisdom with us and your perspective from many years of working at this. I just really appreciate the ways that you break this all down in really plain speech, and that you've marked out a number of different levers that we could use collectively if we find that there is the collective will and the organizational capacity to come together and start to address any of these concerns. I want to mark out that we are far past our time, but all the content really kept us present. I'm very, very grateful to Sally, Jennifer, and Marsha for being our speaker panelists today. And for the large number of attendees, almost everyone has hung on here for almost a whole half hour, longer than we originally intended. The Jennifer and Sally have been able to answer some of the questions in the Q&A panel, and we'll continue to share out that and the recording. Alyssa, if you've got the container slides, I wanted to talk a little bit about, from the USBC perspective, we get questions on every one of these webinars in this series related to what will come now. So, at USBC, as we said at the top of the call, we have a constellation model. What this means is that we form action-focused work teams to work on specific topics. So this particular webinar series, again, was fractured by the recognition that we had really different understandings of what the code is. I think we've learned a lot over the last couple months through the accumulation of amazing speakers coming to us from a variety of perspectives. And we know that we have to be engaged in a shared learning inquiry together if we're going to be really understanding the landscape and understanding what together we might do together. So we've had an incubation conversation where we had an initial conversation with organizations, member organizations that are interested in potentially working together on this topic. Now we've had this webinar series and we opened it up large for the whole field. And I'm very pleased to announce that we've already been approved for CE credits for the first 2 in the series. And we anticipate that this one will be part of that as well. So what do we do from here? So if you represent an organization that is not yet a member of USBC, we strongly welcome and encourage you. The fee structure is very flexible. It's really built to suit. We have a very strong commitment to equity and inclusion, and so there's no barrier to entry. Once you are a member organization, you can assign representatives that can then go into different constellations and to be working collaboratively together towards policy systems and environmental change. So sometime this fall, we will be having another incubation conversation. We would welcome organizations that have joined us in this conversation and learning opportunity across the summer to come and also be part of the next round of conversation. And as in, by way of some anticipatory guidance, what that would look like is really holding what it is that we've learned and asking the question, is there capacity and is there will? And both parts of that is really important. The capacity question is critical because the fact is, everyone is exhausted. We are in a larger, context of pandemic, uprising, climate crisis, all of the other things, and people are really worn down and worn out, and that impacts organizations, and it also impacts organizations unequally. So we're going to have to take a moment and really say, okay, we know that this is important. Do we have the capacity to come together and work on this? And if so, do we have the will? Do we have the will to find consensus? Do we have the will to select from priority strategies so that we're moving forward in a way that is as smart as we can and as focused as we can? And we know that as USBC member organizations, we can do incredible things. We are definitely stronger together.